MRI has made a great difference in terms of the care of patients with multiple sclerosis. By being able to see the lesions that are present on the MRI, we're able to make an earlier diagnosis and also see what happens over time in terms of treatment or no treatment, whether there are new lesions that develop. And the presence of new lesions in particular is very important in terms of helping the patient and the physician looking after them decide whether they should initiate treatment with disease-modifying therapy or perhaps consider changing the therapy over time. And so this ability to be able to see lesions as well as new lesions that develop over time is critical in terms of the care and management of these patients. So what we have done is really try to foster this role of MRI. And this really started almost 20 years ago by my colleague and mentor, the late Professor Donald Patey, who worked very hard, and he recognized the importance of MRI in terms of this role. And he felt that it was important to be able to obtain MRI that are similar so that when you compare one scan with the next scan, any changes that you see is due to the change in the disease process. In other words, what you're seeing is a new lesion as opposed to changes that may occur because of technical reasons, something to do with the scanner or some artifacts or something, so that what you see in terms of a new lesion is really what it is. And so if you can be sure about that, then that will be much more accurate in terms of helping advise a patient and for the patient to understand what is to be done. And so this role of a standardized MR where the scans are done in a similar fashion from one scanner to the next, and ideally having the same scanner over a period of time so that changes that you see are not artifactual but real, makes a big difference. And as I said, this has been going on for the last 20 years. The scanners have evolved. There are abilities to do the scans in much better fashion. And so we've tried to keep up with that and trying to always keep a step so that what you do now can in fact be used to compare with what happened before and hopefully what will happen in the future. And so what we presented is really the efforts of many, many people over many, many years trying to standardize it. And the key of it is people to use it and to adopt it.